thigh bone and the shin bone. Okay, so that there is a point of reference. So this is fixed to the bone with a pin, couple of pins, and likewise the other one, which is slightly different in shape, is fitted over here on the lower bone like this, in this direction. Okay, so that's shown here in this image. And then the surgeon puts the leg through a range of motion. So very cleverly it calculates the hip joint center. See, this is very important. This is the center of the hip joint. This is the hip joint. Now by some strange design by our maker, he put the hip joint not in line with this leg, but a little away. So it gave us the ability to ride on horses and so on. Otherwise we wouldn't have been able to do a lot of things, gymnastics and so on. But how do we find out the center of the hip joint? So what it does, the computer is very clever. When you have this this device here fixed to the bone, as you make it go in a sort of pivoting movement, what the computer does is calculates with the help of the camera the surface of a cone. These make the surface of a cone. As you go like this, as you pivot, it makes a conical surface in space, and it calculates the apex of that cone to be the hip joint. Now the hip joint is so deep down, we don't know where it is. So this is how the computer technology helps us to find out the center of the hip joint. So having done that, we come to the next step now. So we've done that, and now we have to give the computer information about the various landmarks. So if I click, this is the center of this bone. It has figured out the center of the hip joint here. It has now figured out the center of this bone here, and then we give it the center of this lower bone here. And as it registers the point, it has communicated with the camera there, and the camera in turn with the computer, which is linked up to the iPod by Wi-Fi. So we are giving it this information, then we give the surface, and then we give it the orientation, the rotation of the leg. Then we give the lower end of the bone, so information about this point and this point. So based on this, it can work out the exact alignment of the leg. And then we go ahead making cuts. So for getting this surface very exact, we have to put this device here, and then it will just hold this. So we go into that, and it will tell us exactly how much we have to cut and position this. So as we change this device now. Okay, so take that off now. This can come off. So what it'll do is, I'll show it this way, yeah. So as I move it, yeah, can you see? With great precision it tells me how much of bone to take out. It tells me the exact angles. So the surgeon is getting real-time information while doing the operation. So then I can put the various instruments and make the cut.
So just the precision part could you use?
Yeah.
Yep.
So it tells you this, the exact information. As I move this is in communication with the camera, and you can see how nicely it's giving you the information in terms of how much I'm bending it and straightening it in three planes, X, Y, Z axis, 3 axis. So it will tell you all that information, plus it gives you the depth, how much of bone to remove. Alright? And likewise you can then do the lower bone. So when we come to the lower surface, again you can see it tells you how to go ahead and cut it, and then as you move it, it'll tell you how precise you can be in this. Alright, and then once you've done these, you put in the components, and then you can actually check the alignment of the leg. You move the leg back and forth, and it'll tell you exactly how many degrees it is in straightening, in bending. So it gives you very precisely the alignment as well. So it has helped us to do all the things we were telling you about to reduce the risk of failure.
And how long does a surgery like this take?
The actual surgery, I mean, the component, this would take few minutes.
Okay.
You can see that it's in real time almost. So as you click and go to the next screen, you keep on advancing. As you get your cutting blocks, which we need to make this cut, we position it, confirm with this, cut it. So typically in 15-20 minutes, maximum 40 minutes, the whole operation is over.
So normally without this equipment, how much time does it used to take?
Probably a little longer, because you don't go through these steps with conventional equipment. You're eyeballing it, you're guessing. You think it's all right, you use some instruments to figure out, because you can't really find out where the hip center is. Whereas the computer knows it, and it's telling you that in relationship to this, your axis is exact. It tells you where you are in terms of the position. It'll tell you how much it's bending, and it's also telling you this alignment is exactly in so many degrees. So that's the key point. Whereas when you're doing conventional surgery, there is no reading anywhere. It's all in your mind. You think it's okay. I think it looks straight. I think it looks a little, on one side or the other side. Whereas this is high precision. So again, if you come back to this, the